And we use a handheld instrument at this center. We also do traditional chiropractic techniques. On the second visit, patients receive a special acrylic massager as a gift. Tell them how that feels because they have no idea
it's so
what this feels like.
Awesome. This little acrylic massager is kind of like a hand, and it's shaped like a hand. And after I come to see the chiropractor, when I go home, my husband will do like a little massage on my back for me, and it's also really helpful. You can get out of the shower and just do a little massage, and it's like that extra added benefit, I feel like.
Doctors of chiropractic adjust the spine and take pressure off the nervous system. Do you have tenderness here or here?
On this side, Dr. V.
I'm adjusting the sacroiliac joint. I'm using a handheld instrument that's virtually painless. And we're taking pressure off the nerves. The nerves from this area go down the legs, they go to the organs of elimination, they go to the reproductive system, and adjustments here help us be and stay healthy. I'm feeling with my hands where her vertebrae or her backbones are out of alignment, and I'm gently working the bones back in place and working on the muscles as well. I'm going to use a special attachment to help the sacrum and the lower back and open up the space between the vertebrae where the discs are. I'm examining her hips and making sure her legs go in and out evenly. And on her right hip's a little limited when I move it out. It's just slightly limited. So I'm going to use an instrument and work on mobilizing that right hip and get a little bit more movement out of that right hip. And let's examine your knees too while we're here. And I'm going to make an adjustment on the foot, on the head of the talus, and I'm going to adjust the cartilage of the knee, the medial meniscus of the knee. And I'm going to do the same thing on both legs because she needs it. Cartilage problems respond very well to this technique. She also has some torquing of her tibia. It's torqued outward, and I'm gently realigning the tibia and putting it back in place. I'm checking her patella or her knee bone, and I'm aligning the patella with the instrument. So people respond very well at this center to cartilage problems or menisci. Torn menisci do extremely well. Arthritic knees. Checking her alignment. I'm checking the alignment and the leg length. I'm doing a leg length analysis, which is an accurate way of determining whether or not the spine is straight and strong. I'm going to feel her neck. And her neck is tight. It's restricted. It's limited. And I'm going to use an instrument to line up the neck and vibrate the bones. And I'm going to check with my hand to make sure that her neck is moving properly. And I want to get a little bit more movement so we can gently realign the vertebrae without cracking the spine.
It feels really good. I actually had someone crack my neck one time, and it was so painful. And the way that Dr. V does it, by using the instrument and then just gently moving my head, it's so much more effective, and it feels so much better.
And I'm going to work on the shoulders because we all gather tension here. And I'm working on the muscles around the shoulder, and I'm feeling with my hands for vertebrae that are out of alignment. Doctors and scientists know that if the spine is straight, you'll stand your best chance of being and staying healthy. But if even one vertebra is out of alignment, it puts pressure on the delicate and sensitive nervous system. Adjustments to this part of the spine help the kidneys, help the immune system and help us be and stay healthy. Adjustments here help with posture. We'll make an adjustment here, and an adjustment here as well. Is there anything that you'd like examined in particular today besides what we've done?
No, Dr. V, thank you.
And you, of course, you'll feel yourself moving up once again. And the audience is probably wondering what you've noticed with chiropractic care and how you're feeling now. So if you could take a step back.
Sure. I feel like a different person. I definitely know that I stand taller. How I walk is different. I feel like my attitude is different. It just makes you feel better, and it's something good for your body. So I appreciate everything Dr. V has done for myself and my husband.
It's an honor working with you.
Thank you.
If you're viewing us for the first time, share if you care, like, comment, and hit the red subscribe button. I'll be back with something powerful and positive for you and yours. Did a great job today.
Thank you, Dr.
Thanks for
V.
telling them.
Thank you.